even from the questions being asked, the few questions that were being asked, it was very clear that the legislators didn't really understand the subject, right? Here again, I don't mean there's an insult. Well, I mean, they had, 1,000 things they're trying to consider and think through. This is just one little tiny issue, and they don't really understand it. That then led to so maybe, we've tried talking to the insurance companies, that hasn't worked. Maybe if we educate the legislators, that will get us somewhere, right?
And lobbying is how you accomplish that.
And lobbying is how you do that, right?
Welcome back to Dear Healthcare, It's You. Welcome back to Dear Healthcare, It's You. This is Elisha Yaghmai that's with me, and I am Joe O'Hanlon. We are continuing to talk about Elisha's journey becoming a doctor and the cracks in the medical system here in America that he's discovered through that process. And now we're actually in the chapter of he had started a business and a telemed business and had a lot of struggle with insurance companies getting on board, even though their protocol said that it should happen one way. It was not happening that way. So it ensued in a legal battle and some lobbying. So we've touched on some of these pieces, but let's talk about specifically the lobbying. Let's start off, I know the very basics, but for our audience and for my own benefit, what do lobbyists do? What is lobbying?
Lobbyists are people that are generally paid to advocate for a particular outcome or a particular position. They have a kind of sinister, the word has a sort of sinister connotation, but you could think of them as people that go around to educate legislators. That could be positively or negatively, but they go around to share information with them.
From their client, so it's obviously a biased source.
Correct, yeah.
To give them education because these legislators are deciding on many things that they might not have any idea about, or like they have some idea on the alternate side, or...
Yeah, it's that we ask our legislators in our political system to make decisions about a wide variety of things, and I would say they don't know much about the majority of those things, right? Because if it doesn't happen to be in their particular area of work or expertise prior to ending up in the legislature, why would they know about that?
And it's not just part of their due diligence to do their homework.
I think, as with anything, there are probably legislators that do a lot of due diligence and a lot of research and have an active staff, and then there are probably others that are less inclined to do that.
I see.
And so the lobbyists exist to provide education and information, whether accurate or not, biased or not is a different question, right? But provide information to those people to try to either teach them about it or to sway them from whatever their perspective is to some new angle.
Yeah. And you were encountering such issues with private insurance specifically. Is that what this was about?
Yes.
Required lobbying?
It did, yeah, because the private insurance was in the state of Kansas, was regulated by the state of Kansas. Like we couldn't influence anything that was going on with Medicare because that's a federal program, right? So you would need to go to the U.S. Congress, which is a whole other level of engagement and spending actually required to even begin to engage with that.
Spending in terms of lobbying.
In terms of lobbying, yeah. And we did try. I mean, for what it's worth, we actually did try to engage the Kansas congressional delegation. So we tried to contact our senators. Actually, a couple times we got blown off most of the time. One time we got punted to their junior staff. Who then sent us back to the exact same people that we had talked to at CMS before who couldn't do anything, right? So that was just a different level, basically, that we weren't able to execute at successfully.
But for state legislature, when did you, was it clear at a specific point of okay, we've tried these other things and now we need to take it to this point of lobbying for legislature change?
Yeah, what made it clear first was, initially was just as we've described before, right? Private insurance had laid out this is how you get paid for doing virtual care, right? And we checked all the boxes. Then they made up some more requirements that weren't in those, and we checked all those boxes. And then they said, "Oh, sorry, we don't care, right? You're not going to get paid."
Yeah.
So we then went from that to, well, we just need to share data with them. We need to enlighten them more. They didn't even want to talk, right? So that was the experience. And then actually what happened was I think it was early 2017, we found out that the state rep from Independence, Kansas, had introduced legislation to the Kansas State Legislature to try to get telemedicine paid for. I think, if I recall correctly, I think at that time it was a payment parity bill.
And can you remind our audience what payment parity is versus payment required?
So payment parity is basically where you say if the insurance is going to pay for whatever it is virtually, then they should pay the same amount of money as they would pay for it if they were doing it in person.
Okay.
So the concern for those that were trying to do anything in telemedicine at this point was they were worried that insurance was going to say, well, if we pay you $100 to do this in person, we're only going to pay you $50 to do this virtually, right? That was their concern. And so if I recall correctly, I think the bill was if you pay $100 for it in person, then you should also pay $100 for it virtually if you choose to pay anything, right? That was, I think, what it was. So we actually, I can't remember now how we even heard about it, but we went up to the hearing in 2017. We attended that hearing.
Oh, okay.
And so in the hearing, there was a committee meeting, and it was an hour-long hearing. More than half the hearing was spent on a very non-controversial vaccination bill about something, I think the meningitis vaccine, if I recall correctly. Really non-controversial. That took up the bulk of it. And then there was this last little segment that was supposed to talk about this telemedicine bill that this rep had introduced. And in that hearing, there were, I think, if my memory is correct, it was like 13 parties testifying in favor of this bill. We were one of them.
Okay.
The parties, there were, I think, 12 mental health outfits of one form or another, and us, right? We were the only ones that were doing anything other than psychiatric medicine. We were doing all the other kinds of medicine, right? We each got 2 minutes to speak in favor. There were 2 parties that were opposed. They were both state insurance companies, right? They got 5 minutes to speak against, right? and then there were 2 parties that were testified as neutral, right? One of whom was the KU Center for Telemedicine and Telehealth, right? So they were. Y'all can process.
Already doing this.
Y'all can process this. The KU Center for Telemedicine and Telehealth was neutral on whether telemedicine should be reimbursed in the state of Kansas.
So they surely would have been having the same payment issues.
Yeah, they're having all the same payment issues. Yeah, but their official position was that they were neutral.
Why? I mean, speculation, of course.
Speculate. Yeah, I mean, we never got a
statement.
We never got a statement from them on it, but it seemed to be that KU in general has plenty of traditional insurance contracts and didn't want to jeopardize those relationships by formally opposing the insurance companies, right, in a public forum. So
for this one smaller
for this
sector
one,
of
they're like,
telehealth.
telemedicine is like a tiny fraction of what they do, right? So they're like, we're not going to mess with all our other relationships and create a fight over this little itsy bitsy thing that we barely do anything with, right? We're not going to risk that.
I see.
So it was an entertaining hearing in that we have people testifying in favor getting almost no time, and then the neutral people the hilarious part about their neutral testimony was that it sounded suspiciously incredibly positive. It sounded like they very much favored the legislation, but their formal position was that they were neutral on it. And then of course the people that were speaking against it, right? And
who was the other neutral party?
Kansas Medical Society, if I recall correctly. I think that's correct. I think they were the other one, right? So we have these, all of this kind of going on, and then the frustrating part about this hearing was that the people get up to speak against it, and they stated some things that were just factually inaccurate. And I don't necessarily know that they were lying in the sense of like we know what we're saying is untrue.
Okay.
But
you knew what they were saying was untrue.
It was very clear to anyone that knew the field that what they were saying was decidedly factually untrue.
Okay.
But they were presenting it, and there was no chance for rebuttal. So it was basically kind of the way our politics works right now. One side says something, the other side says something that completely contradicts it, right? It may be factually completely untrue. Nobody knows. Yeah. There's no chance for engagement. There's no chance for rebuttal. There's no chance for debate. There's no chance to say, let's look into the data and actually see what's true.
Yeah.
None of that was possible. And so that hearing just concluded with, there seems to be disagreement about this, so we'll just table this and maybe we'll look at it next year.
And this was not your hearing that you had instigated. This was the one that the state rep had started.
Right. This is the one the independence rep to consider his legislation that he'd introduced.
Yeah.
Right? So, we finished that up. Outside of the hearing, we got some positive feedback from some of the neutral parties saying, hey, we really actually kind of support your perspective. Mm-hmm. It's just, we're not going to wade into that right now. It's not expedient for us to wade in. But y'all, keep right at it, right? And we're like, this is great. We're dying, hey.
Right.
But glad to be the tip of the spear. So what we got out of that, what was very interesting to observe was, again, even from the questions being asked, the few questions that were being asked, it was very clear that the legislators didn't really understand the subject, right? Here again, I don't mean there's an insult. Well, they had, 1,000 things they're trying to consider and think through. This is just one little tiny issue, and they don't really understand it.
And it was
Yeah.
a new thing that, it's not
Right.
like they could just dive into existing understanding of it that
Right.
other people had. That was very minimal.
That's
because it was a new
correct,
thing.
right? We had just spent 3 years, 4 years, right, teaching ourselves about this, right? So why would these people that weren't in this field and are not, in this and don't have this background, why would they know all of this, right?
Right.
There's no reason they would. So that then led to so maybe, we've tried talking to the insurance companies, that hasn't worked. Maybe if we educate the legislators, that will get us somewhere, right?
And lobbying is how you accomplish
And lobbying
that.
is how you do that, right?
Okay.
So one of our partners, I forget how he met him, and it's maybe some random connection that he had or whatever, somehow or other connected us with 2 guys that had started a lobbying outfit in Topeka.
Okay.
Met with them. They listened to the whole ordeal that we were going through, felt some sympathy for our cause, and so they agreed to work at under their current market rate.
Okay.
So they gave us a discount because we couldn't afford any more than that. We still didn't have any money.
Right.
So what they once again, I just went and tried to find more side hustles to generate enough money to pay their fee. But what they did out of that was they got us a meeting with the chair of the health committee, or I can't remember exactly which committee it was, but it was a healthcare related committee. It's the chair that they got us a meeting with him over the summer. He gave us about an hour of his time, which was very nice.
Can I pause you for a second?
Sure.
So it's a healthcare committee. So they were familiar with healthcare in general
Right.
in terms of the legislation around a specific topic. They're not just having to vote on
That's right.
everything.
This was not the general legislature. These are people that are on the health committee, right? But
so they're
still,
starting at a level of understanding that some people wouldn't have at least. Yeah.
It's slightly higher, right?
Yeah.
But again, I mean, in American politics at this point, right, there's lots of reasons people want to be on the health committee, right? They may be there because they have concerns about, reproductive rights, or you know what I mean? They're in there they may be there with a specific issue in mind.
Okay.
And all this other stuff is sort of peripheral to that. They're there for that, right?
Okay, I see.
And you pick your issue. It doesn't matter what it is.
A lot is connected back into.
But all of that kind of goes on, right? So it doesn't mean that this is an extremely well-versed person that really understands the healthcare business or how it all works, right?
Yeah.
They may have a specific issue that they're there for. So, but this gentleman gave us like an hour of his time. So we go through everything. We laid out all the stuff that we've talked about, what our experience had been, what we were doing clinically, like what kind of good it could do for the rural communities. And he asked us a question. He's like, why are we not doing this everywhere in the state already?
Right.
And we were like, well, funny, you should ask.
So actually, we are. Would you like to pay us to do that?
Right. So
what year was this that this
This
started?
was, I think, in 17, if I recall correctly. I think it was the summer of 17 when we had this conversation. So he said, okay, we got to fix this. So he said, I'm going to get an interim hearing together, like in between the sessions of the legislature. I'm going to get an interim hearing together with a joint committee with House and Senate members in it. And we're going to have a meeting and talk about this. And true to his word, he did. Right. So I want to say it was November of 17, if I recall correctly. I think that's correct. He went ahead and got this committee meeting together. So we did. So then I think if I recall, I think it was a 2-day hearing. So we went up there, and so this time around, it was a very, very different format. One, it was dedicated to the question of telemedicine. Okay. Right. So that was helpful. And then there's much more time. So this time they had 3 parties speaking in favor. We had 30 minutes each. Okay. And then they gave the people speaking against, which again was all insurance companies, right? It was all the Kansas-based insurance, the usual people that you would think of, speaking against it, right? Okay. But they gave adequate time.
What was the arguments against it?
The argument, one of the arguments was you can't do very much with this. It's just not very useful clinically, right? You can't diagnose things. You just can't do good medicine this way. That was not true. Right. But that was one of the arguments. Another argument was it's not necessary, right? People in rural Kansas and other places, like they've got adequate access to care. Like there's really not a need. That you don't need all this stuff. Like it's just not necessary. Okay. These were the types of arguments that were being made, right? And that was. These things were demonstrably untrue.
Right. I was going to say, none of them were fair points in your mind.
They were not. Yeah. And then there was one point I think they'd made at one point, which was, well, we are paying for telemedicine. Like, if you submit the stuff properly, we will pay, right? So, yeah.
Who were they paying?
Well, not us, right? But they would use things like, well, we're paying the mental health people, which at that point they were. They were paying some of the psychiatric people, right? So we pay for this, right? And we were like, no, you don't, right? You don't. And here's, 200 unpaid claims, right? To show this. So again, the difference in that particular hearing was that there were different people there some of whom had an actual professional healthcare background, so a slightly different audience in terms of just baseline level of knowledge. And so in that one, after everybody made their statements, this time around there was time for questions and there was time for rebuttal.
Okay.
And so they asked questions. They would stand up and kind of give whatever their statement was going to be. And then in a couple of these instances, they gave us a chance to rebut. And that, I think, is when actual progress was made. Because when there was a chance that we could have an actual debate and we could discuss what the issues were,
you
right?
And
we've talked
very easily point out like what they're saying is not true.
So one, here's factual inaccuracies, right?
Right.
And this was actually one of the things that we came to in this hearing was, okay, if you have legitimate concerns about utilization, about potential fraud, right? It's not that your concerns, this is, again, it's going to speak so much to our political process. It's not that your concerns about this are not real or legitimate.
Right.
It's that the way you've chosen to go about this is through non-communication, obstruction, and in some cases, what appears to be dishonesty.
Right.
Whether intentional or not, I don't know, but it appears to be dishonest, right? Why are we doing this?
Right.
We know that there's a need for what we do. We know that there are concerns that you have. Can we please meet at a table and hash out a way that both parties can get what they want? We want to be able to provide better care to rural Kansas. You want to not have your budget blown by fraudulent doctors claiming all these visits they didn't do, right? And all this kind of stuff, right? Fair enough, right?
Right.
There's ways we can do this.
Right. It's not cutting insurance out. In fact, it is factoring insurance in.
It's factoring insurance in, right? And we can actually, I mean, ironically, right, by doing this the right way, we can improve the quality of care. We can improve the accuracy of what's going on over what's done in person.
Yeah.
Right. And we can save you money doing all this.
I was going to say, at less expense ultimately to them.
We can save you money. As mentioned before, right? We weren't coming in saying you need to pay us more for this. We had come into them saying pay us less.
Right. We'll
give you a discount off of our. We don't even want payer parity.
Right.
We just want you to pay for it in some form. So we have some. When we go to our pro forma, we can plug a meaningful number into that and then figure out what we need to do in response to that, right? But it doesn't even have to be a one-to-one. We recognize our expense to do virtual care is lower.
Right.
So we can save you money on the fees.
So you'd already conceded what had already been a dilemma point in the past for them.
We conceded all this. So where this ended up was after that hearing, the lobbying firm told us it seemed like the opinion in the legislature on this issue had changed, right? With a majority of the body now in favor of passing some legislation. And the difference in the legislation that was proposed this time around was that we had asked for guaranteed payment. So we didn't specify how much had to be paid.
Right.
We just said, if you're going to pay for it, let me rephrase that. We said, if you would pay for this in person, and it can be done virtually, you must pay something. If it's done virtually.
Yeah.
But we didn't
because
mandate how much it was.
Because before they were just saying if it's the payment parity pieces, if you would pay, then you have to pay the full thing. And so they would just say, we're not paying.
Exactly, right. Or they would we also added in language that you can't refuse to credential somebody because they want to offer virtual work, which was the loophole they were using for us, right? So yes, in the places that had done payment parity, the loophole, which people had used to get around this was, we would pay the same, but nobody wants to offer the service.
Right.
Well, they didn't mention, nobody wants to offer the service because if they want to offer the service, we exclude them from our
yeah.
panel, right? We don't even let them in.
Nobody in our phone book.
Yeah, exactly, right. So this was the way around that was mandate payment, and you see explicitly by law, you cannot exclude us from credentialing just for this reason.
Right.
So that legislation went through.
Does that all happen on one day, or
no,
is this
no,
a multi-month process?
So then after that, so that hearing, all that hearing did was establish a change in the mood, is probably how I would describe it, right? Now the information's out there. We've had some actual engagement on the issues. The legislators, as we were told, we didn't go poll everybody, but as we were told by the firm we were working with, had changed their opinion, right? And so it became clear that something was going to happen.
Okay.
And then once again, speaking of American politics, right? We had been one of the main drivers of getting this thing to this point. We were completely cut out of the process. Whatever happened after that in terms of negotiation, we had nothing whatsoever to do with. We were not invited. We didn't know what anything was. All we knew was that when the bill went, I think, into the Senate hearing in the winter of 2018.
So a full year later.
Not a full year later, like 4 or 5 months later, 4 months later maybe. By the time that bill came up for discussion there, insurance was suddenly firmly on the side of telemedicine. So they had been adamantly opposed to it before. In a very short period of time, 180, they were completely in favor of telemedicine all the way around. They absolutely supported the legislation and everything that had to do with it. and it just passed through.
So it just passed?
Yeah, passed through, yeah. So
Wow.
again, what happened was the real power brokers in this state, right, which
Yeah.
was not us, right, sat down with the insurance companies and they hammered out whatever arrangement was going to work for all of them, since something had to be done, right? And then everybody was on board with it, and then suddenly the problem was solved. And
Wow.
so then in May-ish, spring of 2018, the Kansas Telemedicine Act passed. It got held up for a couple months because they wanted to add language that had to do with abortion issues, and it was. I'll spare everybody the details, but that kind of held everything up. But it finally got passed as part of another bill. It was called the Kansas Telemedicine Act, and then it went live January 1st of 2019.
Wow.
Yeah.
Okay. And then COVID comes, March 2020.
Right.
And then did everything change at that point for everybody's state, like
Yes.
nationwide, to be comparable to what we had already gained in 2019?
So in 2019, what Kansas did was relatively out in front of the curve compared to most of the country. It actually was, but it was a game changer for us.
Like one of the first, if not the first states to do so, right?
It was of that type of legislation, I think, so of payment guaranteed legislation. If we were not the first, we were among the first to do that. We may have been the very first. But just in terms of everything that we had done with that, it was out in front of a lot of other places which were way behind. And then so ironically, we had that environment. That's probably the reason we made it. Right?
Yeah.
It was because that changed. And then 2020 COVID hits, and then all of a sudden, all the stuff that we fought so hard for, they changed it all overnight. So CMS, we talked about a previous episode, right? They told us we love what you're doing, but no one here knows how to change any of this. They figured out how to change it. And they changed it
for Medicare?
Yeah, for Medicare. So they went from being unable to figure out how to change their manual and their rule books to being able to change it within the space of a few weeks. All of a sudden, they figured out, somebody in that organization figured out what lever to pull to change everything. So they opened all the doors, all the rules were gone, all the restrictions were off. Anyone, anywhere could do anything they wanted, basically. And that continued through the entire COVID pandemic. And that in turn now telemedicine, people hear it and they're very familiar with it. Everybody knows what it is. They've all experienced it. But we went from the complete opposite of that to having all of that within the space of a very short period of time.
Yeah, I mean, it's hard to even, in a lot of ways, it's hard to think back pre-pandemic life. But telemedicine is such a large component of our conversation now. It's very regular for anyone to be talking on the phone to their doctor or something like that. Was that even a thing, like in terms of direct, not having to go to the hospital for telemed, but like patient direct to provider on your phone or something like that prior to 2020 or 2019?
There was a little bit of it going on. There was not nowhere near as much as there is now.
Sure, yeah.
So there were two companies at that time that were trying to do this on a national. They had a bunch of money behind them. They'd raised tons of funds, but their actual utilization numbers overall were low. So to give you an example, like even for video calling, one of the largest, which was a company called Teladoc, they were still doing mostly telephone telemedicine. They had been doing that actually for several years, like back in the 2000s, if I recall correctly. They were doing it for employers, but it was a telephone call that you would do. And even up until close to that time period, we were talking to people that were familiar with their operations. They were like, still the bulk of what was going on was telephone-based calls, not this like video calling and everything else like that. So that really kind of blew up in much more recent times.
Was there any sort of did you feel a little jadedness or jealousy of everything going into effect so easily all of a sudden that you had worked so hard for?
Yeah, I would say the feeling, jealousy may be the wrong word for it, but it's like that, it's like getting out on the front end of any sort of meaningful movement. And, I'd say to some degree, kind of empathize, like people, maybe they're on the front end of like a social movement or something like that, right? Where it's like you push and it's so hard and it's so hard and it's so hard and it's so hard and you just keep getting punched and punched and punched and punched. And then like something happens that's external to all of that, right? Yeah. And then all of a sudden it's like the wall falls down, right?
Right.
And you're like, I have been chiseling at this thing with my little tiny hammer and my chisel for so many years, right? And then this bomb just dropped in this whole thing and it fell and now it's all over, right? Yeah. It's like that, right? And it's like, we did all this work to get incremental, tiny little progress. And then
with so much effort
effort and so much suffering to do this. And then now it's all over. And everyone else that didn't do anything during all of this, right, now has access to all of these benefits, right?
Yeah.
Without ever lifting a finger, right? It's just the way, it's how life is, right?
So for you, in terms of you've been fighting so hard for this thing, once it passed, there was a year until there was such broad stroke change everywhere. Yeah. But what changed for you in 2019 besides getting paid? What did that end up changing in the trickle down effect of it all.
The trickle down, getting paid helped a lot.
Yeah.
But it enabled us to start to distribute our services more widely because people started to become more open to it.
Yeah.
Hospitals began to understand better how they could get paid for it. And actually there was a guarantee that they could get paid for it, right? So patients
the understanding
slowly started to understand
is that just because you'd talked to them long enough at this point?
Yes. Mm-hmm.
Okay.
Yeah, we kept the conversation going. We would notify people what was going on, and then they began to follow, right? They were aware of these things, and so that opened up a lot of doors, right?
Yeah.
The fact I think that we had participated in that, like within our state, was some people knew that, right? So that also helped open some doors because
that's a big credibility point. Yeah.
So it's kind of we were here from before this was cool,
right.
that kind of thing.
The original Dr.
That's right. So so all those things helped.
Yeah.
And helped us gain some traction.
Did it decrease the amount of stress that you were holding?
Yes, at that time it did. Yeah, it did. It was still,
because you're still having to run a business that was still a pioneer business.
Oh, and we were still, bear in mind, right, it wasn't like 2019, we're like, snap, now you're like debt free and,
Right, that's what I'm saying. We were in the hole
we were
quite a ways.
We were way in the hole, yeah. So it took us, we didn't have our first, I think our first year of profitability, barely profitable, and not like actual profitable, just for that year, like not losing money.
Right, yeah.
2019 was the first year we closed a tiny percentage above even.
Wow.
Ever. So from 2014 until 2019, it was just loss, like ever, just loss, debt accumulation, loss. So 2019 we finished slightly above water for the first time.
At what point you said it started as for-profit? In the last episode we talked about that just briefly.
Mm-hmm.
And then Free State at some point became a nonprofit, right?
No. It's not.
It never did.
It didn't. No, we added a nonprofit entity later.
Oh, okay, I see.
Yeah,
but this component, it was your goal was still to get to the point of making something.
It was at the time, right?
Yeah.
And this is a thing that also shifted, right? It did shift over time. So initially, right, bear in mind the beginning of this was just supposed to be a staffing issue, right? We're just solving a little tiny staffing problem in rural. We're going to make it cheaper, right?
Yeah.
That was about it. So we just threw together the company, didn't really think much about it.
Right.
All the things learned over this entire process, right? By the end of it, really, really made me question actually the whole concept of kind of for-profit.
Yeah.
Even though it wasn't for-profit in the way that some of the for-profit entities in healthcare operate, and we operated effectively as a nonprofit almost our entire existence.
Yeah.
By
circumstance, not by choice.
But my concept of sort of what healthcare economics and motivation should be changed more from the entire experience.
Yeah, I bet.
Yeah.
Well, I think that unless there's anything else about the lobbying process specifically that we want to talk about, I think we'll go ahead and wrap up for this week. Thanks for being with us and join us next week.